Let's talk to Government Minister of Responsibility for Care Minister Helen Whately, who joins us now. Good morning to you.
Good morning.
I suppose the first question has to be very straightforward to you, a question really, which is, have care homes been forgotten in all of this? With the coronavirus deaths, we're told there may well be 4,000 people who've died already of coronavirus, and yet those numbers have not been counted in the official statistics. Have they been forgotten?
Not at all. The whole way through, the government has been thinking about health and social care as a whole system because they're both dependent on each other. So as we prepared for the coronavirus pandemic and now as we respond to it, as I say, we are thinking very hard and working really hard. The whole team's working very hard to support social care as best we can. It's not easy to do. We have thousands, nearly 30,000 care providers all across the country looking after some of the most vulnerable people who we know are at greatest risk of complications if they catch coronavirus. So it's really, really important, and we're doing our absolute best to both protect those residents from catching coronavirus and to making sure that the care is there for them, and also to support the workforce in caring for them. But I won't say for a moment that it is easy for us, or in fact any country around the world, responding to this horrid disease.
Well, I mean, it may well be the case that the government's doing its best, but it would appear the government's best in this particular field has not been good enough. I've raised the issue with your own boss, Matt Hancock, the Health Secretary, previously. Like many people, I've got an elderly relative living in a care home. They had 11 suspected cases of coronavirus a week or two ago, unable to get any testing, nothing, absolutely point blank refused any testing. Finally, a patient sick enough to go into hospital got tested, confirmed no more tests available for staff or for other residents. We're told that there is going to be a coronavirus test for every care home resident showing symptoms, and all care staff as well, as capacity increases. But when is that going to be? How many more weeks will we wait for that?
So as you say, and what we have been doing, and what Public Health England has been doing, is testing residents in care homes where there's been an outbreak to confirm the outbreak, but they haven't.
No, you haven't been. No. With all due respect, Minister, yeah. I have spoken to numerous people involved in the care home sector, and obviously spoken to the care home where my aunt is resident. They are all reporting, almost to a man and woman, that they are not able to get tests. That is simply not true.
Well, we have been carrying out testing, as I described, for the outbreak. But let me come to the policy
That's not true.
Able to announce. Let me come to the policy I've been able to announce today. We're able to announce today, which is that as we ramp up testing, there are three things that we are doing. One is that we will introduce testing for every resident in a care home who has coronavirus symptoms, and we know that this is something that care homes very much want to be able to.
And when will that be?
So as we are ramping up testing, there's not a matter of waving a magic wand and being.
No, I don't know. I don't expect that. But can we have a rough idea? Your boss said that we'd have 100,000 tests every day for antibodies and antigens. Vast majority of those would be antibody tests by the end of April. We're halfway through April now, and you are right now. I know the best efforts are going in. I'm not unsupportive of the government's efforts on this, like a lot of people, but you're nowhere near reaching that. So when you say you're promising that everyone will get tested when we've got capacity, when do you expect to have that capacity?
So that we are, as you well know, because it's been talked about a great deal, we are working to achieve 100,000 tests a day by the end of the month. The other thing I wanted to talk about was the testing of workers in the care sector, which has already begun. So already around 1,000 care workers have been tested, and another 1,000 have already been referred for tests, or due to have tests. And this week, CQC, the Care Quality Commission, is contacting nearly 30,000 care providers, registered care providers, to line up their staff or family members of their staff for tests, so that we can make sure that we have the workforce we need in care homes to look after people, whether or not they have coronavirus.
Okay, but can I ask you once again, when, roughly, I don't expect it to the minute or even to the exact day, are you expecting to be able to do this and test all the people who in residence and care home providers and carers? Are you expecting to do that within days, within the next week, by the end of the month? Can we have a rough idea of when this will happen? Because this is, if we don't know that patients or carers have got coronavirus, they're going to be spreading it to other residents. And these are the most particularly vulnerable people, as you well know, in our society. Basically, if coronavirus spreads in a care home, we are likely to see mass deaths in that care home. So when are we looking at?
I think you're asking me a question to which there isn't a meaningful answer, because testing is going to keep happening while we have the pandemic, while we have anybody who has coronavirus symptoms in the country. So it's not like it's going to be all done by tomorrow, because
I'm not expecting
the virus
that.
that's in the
If the vast majority of people who run care homes, with all due respect, if the vast majority of people who run care homes saying they can't get testing for their patients, for their residents or for their carers, and you're saying we're going to roll it out, is it not a reasonable question to ask? Roughly what time frame would that be happening in?
Well, we're rolling it out now, but what I said is it's going to be ongoing over a number of days and weeks. It won't be something that you do and then it's finished, because you will... for as long as we have the virus around, there will be people who will catch it.
Of course. At what point will it be the case that any resident suspected of having coronavirus or any carer will be able to get tested within a day? At what point? Give me a rough idea for that then. I'll give you a more specific question.
It feels like slightly we're going around in circles. I mean, I've announced that this is...
Because you're not answering my question.
I'm giving you the answer I can give you, which is that we're introducing a policy of giving access to testing to care workers and to care residents. I'm very sorry. Also, we're running a little bit late, and I do accept that. It's ringing in front of me because I know I'm due to be on with another broadcaster, which is making it slightly difficult as I'm doing my best.
Well, given that broadcaster that you're due to be on has made my guests late many times in the past, I'm going to put one more question to you. In terms of the HS2, it's been announced in the last few moments that HS2 construction has been given the go-ahead. Do we really have a spare £100 billion at this time to spend on a new railway service?
And as you heard the Chancellor talking yesterday about the economy, is that we really want to make sure that as we move out of this crisis of coping with the pandemic, that we have a strong economy, that the economy is able to bounce back. That's why we've been supporting businesses as best we can, supporting the workforce, trying to keep people in employment. And that's why we want to be able to continue to invest in infrastructure so that we can have really strong economic growth, so that the prospects for people are bright as we move forward.